everyone, happy Thursday. I just want to say thank you for following along again with me as we continue the road to baby Thomas. I know last time we spoke about me having fibroids, me having the fibroid surgery. So the fibroid surgery was in February of 2019. So once we did the surgery, January 2020, my husband and I decided that we were going to start trying. We were trying from January until about September. Now, infertility is when you are 35 years or older and have been trying for at least 6 months unprotected and have not gotten pregnant. It is also if you are under 35, trying for a year unprotected and had not gotten pregnant. In our case, I was under 35 and we were trying for more than 6 months. It was definitely less than a year, but I knew there was something wrong and I did not want to wait. So September, we decided to go and see a fertility clinic just to check everything out to make sure everything was good. So for my husband, they had him do a semen analysis. This is where they checked the sperm count, they checked the motility, they checked the morphology, and they also just ran all his vitals. Everything came back fine for him, no issues. For me, I had to do an HSG. So this is an x-ray where they do a procedure to see if my fallopian tubes are open and check the shape of the uterine cavity to make sure everything is normal. So I did that. Everything looked, fine for the most part. We did ovarian reserve testing. We tested my FSH levels, my AMH levels. We looked at my TSH levels. And then we did a transvaginal ultrasound. So when we did the transvaginal ultrasound, we were able to see that there was actually a fibroid in the cavity. So my doctor said to me, this could be what's preventing you from getting pregnant. And even if you got pregnant, you would possibly miscarriage just because of where the fibroid was. So we had to have another fibroid surgery. Thank God this fibroid surgery would not be as hard on my body and as long as the surgery as the first one was. This one was supposed to be less than an hour in and out. So this was September when we found out about this. In October of 2020 was when I had the surgery. So I was put under general anesthesia and I had to do a hysteroscopic myomectomy. So this is where they went in transvaginally with a camera and with instruments, and they took out the fibroid that way. Once I was awake, I was able to leave. I had some spotting, a little discomfort, but within a day I was back to normal. So there wasn't really much of a healing process on me having to take time off from everyday life. The doctor did say, however, we had to wait until the next period before we could start trying. So the next period came and we started trying again. Now throughout this whole process, I was doing ovulation kits, I was drinking different teas, like anything you said, name it, I was trying it because you know what? I was gonna give myself the best chance I could get. I remember even after that, I still wasn't getting pregnant, and I didn't know what it was. And I have a type A personality where I tend to want to be in control or need to know what's going on. So for me, not knowing what the problem is or how to fix it was a lot for me. During that time, it was COVID, and a lot of fertility clinics were not taking patients. I remember if it wasn't anything detrimental, they weren't doing any surgeries. So this gave us some time to really sit and think about it. And I said to my husband, we're either going to try intrauterine insemination, also known as IUI, or in vitro fertilization. I think that was a hard reality for me, because in all my years, I always thought once I was ready to get pregnant, it would happen. I knew I had fibroids, and I thought that once the fibroids were done, then we would be fine. And so after going through a year of trying, having another fibroid surgery, now we're at the crossroads. What do we want to do? Do we want to do IUI? Do we want to do IVF? Do we want to do the less invasive one? Do we want to go for the most invasive one that gives, the highest rate? What is the cost associated with it? Can we afford the cost? So these were some things that we had to sit with. And because it was COVID and all that was going on, we had time to really think about it. And for me, I sat with it, because I didn't think that this was going to be my choice. In terms of, I thought that, once I relaxed, like everyone said, once I didn't stress, like everyone said, once I made sure I was in tip-top shape, I would be fine. But the reality of the situation is, it came down to two. Which route do I want to go? So next week, I'm going to go a bit more in depth. I'm going to discuss more about what IUI is, what IVF is, what caused me to go with IUI before I went to IVF, and take you through the process, the costs associated with it, how we were able to pay for it. Okay, so stay tuned for next week. Thank you.